My name is Morgan Norris, and I'll be doing the ranges of motion. The reason why we do this is to promote joints working as well as they can. We want them to do that. We don't want them to get tight or joint problems. We don't want them to be constricted or anything like that. We want to keep the movement available, possible. We want to promote that. First thing I would do whenever I walk into the room, I identify myself. My name is Morgan Norris, and I'll be your nurse today. I would make sure that their name and the first and last name, I'd ask them for that, and their date of birth, and make sure it corresponds with their wristband and my charts. I would perform proper hand hygiene with the Germex, making sure it's dried before we jump into range of motion. The first thing that I would do is the head and neck region. First, I'll do extension, which is normal, hyperextension, flexion, rotation, and lateral. Next is my shoulders. I'll do extension, hyperextension, and flexion. Next is external rotation and internal rotation. Next, we're going to do abduction and then adduction. Next, we're going to do my elbow. We're going to do extension and flexion. We're going to go down to my forearm, and we're going to do supposition, and then pronation. Okay, next is my wrist, and I'll do extension, hyperextension, flexion, and then adduction and abduction. Ab with B and add with the D. Okay, next is my finger and thumb. First I'm going to do extension, hyperextension, and flexion with my thumb out. And for my thumb, I'll do opposition, extension, and then hyperextension, we're going to go towards my radius. And then adduction with my fingers, away from the body, or away from each other, and then adduction together. Next is going to be my hips. I'm going to do extension, hyperextension. It's sort of the uncomfortable position. And then flexion in front of me. And then I'll do external hip rotation towards the outside of the hip. And then I'll go into the internal rotation. And then next I will do adduction away from the body, and then adduction to add into the body. Next is my knee, and I'll do extension, and then flexion. Next, I'm going to do my ankle, and that is going to be my dorsiflexion, and then my plantar flexion. Okay, and then my inversion, which is in towards my body, and then eversion towards the outside of my body. All right, and then with my toes, it's the same thing as my hand. I'd curl them in for flexion, and then a flat foot would be my extension. And that is all for my range of motion.